So this talk is sponsored by BioLace. Erbium lasers could be used to quickly and safely remove veneers and crown restorations. For this study, we used a range of materials. Basically, this would be effective on anything other than metal restorations. We used full zirconia, porcelain-fused zirconia, and lithium disilicate. Veneers and crowns. For cements, we used resin and glass ionomer cements. This would also be effective on RMGI cements. We tested a range of laser settings, looking for a safe and effective range, and we tested a range of thicknesses of restorations. In total, 36 veneers were completed and 119 crown removals were completed. Safety was defined as not increasing the temperature more than a few degrees at the dentin or in the pulp chamber. For veneers, they pop off so quickly that we're really just looking at the temperature at the dentin. That maximum temperature recorded was 3 degrees. Maximum increase recorded was 3 degrees. Within the pulp chamber, we filled the pulp chamber with thermal conducting paste, inserted a thermocouple, very thin wire, up against the floor of the roof of the pulp chamber. Tested the thinnest crowns, of course, and we're looking for the maximum settings with a safe temperature rise. The maximum recorded at 320 millijoules was 3.8 degrees Celsius. Of course, if you go above 320 millijoules, the temperature increases were higher. So we don't recommend going above 320 millijoules. For efficacy, we're looking at a decrease in the pull force necessary to remove the veneer or crown. For veneers, they popped off very quickly, within 30 seconds for the majority of them. A few 2 millimeter thick restorations remained for a little bit longer than 30 seconds. For crown removals, we tested pull force necessary at 100 seconds, 200 seconds, and 300 seconds. All crowns except for 2 were removed in less than 5 minutes, and the 2 that remained still adhered to the molar you can see the pull force was greatly reduced. You could remove them by hand. And all but 2 very thin crowns remained intact. You can see the progression of the removal process here. So we start with the cemented crown on a molar. You can see the way that the crown looks after it's removed. You can see the cement is still adhered to the tooth after cleaning, and you can see the example of a thick crown and the thinnest crown on the right. Here's another set of images of the tooth baseline right after crown removal. This is our worst case, or meaning the highest fluence settings with the smallest diameter tip, maximum energy settings, thin crown. You can see the laser, the way that it acts is it penetrates all the way through the ceramic or glass, the restoration, and it affects the cement underneath. It starts to ablate it. So you can see a little bit of ablation there. We do not want to ablate all the way through the cement and start to ablate the dentin. And after cleaning with a hand scaler, that's the appearance of the tooth. Some more images of different molars after crown removal. You can see GC Fuji cement on the left, and on the right, the resin cement. Some pockmarks of the laser pockmarks on the cement. The crowns were reused, and after 12, so basically after removing with a laser, you can reset the crown, reposition it. After 12 repeat cycles, you can see that really the main change to the tooth is just the scratches from the hand scaler. This after a full zirconia crown. This one is after an EMAX crown removal, and this one is after a PFC crown removal. So it works with many different materials. So the way that this works is erbium lasers can transmit all the way through the prosthetic. They interact with the cement and start to ablate it. The treatment depends on the material thickness, so the thicker it is, the longer it might take. The lowest, you want to stay with the lowest settings, and our safe energy and setting range is 140 millijoules to 320 millijoules at 15 to 25 hertz. And you want to use as much water and air as you can to keep the area cool. So actually I have a video. The technique is to, for any restoration, veneer or crown, you want to paint the entire surface of the restoration, starting with the margins, and paint in every surface, up to a minute per surface. And you could take breaks in between. So really crowns up to 5 minutes, veneers 30 seconds.